Nursing homes are often seen as safe places for elderly care, but they can carry serious risks that families may not fully realize. While many facilities provide essential support, others may expose residents to harm. From neglect to emotional isolation, these risks can deeply affect seniors' quality of life. In this series, we'll explore 6 important reasons why nursing homes might be risky for elderly people. Number 1. Risk of neglect and inadequate care. One of the most serious risks elderly people face in nursing homes is neglect. While many facilities are well-run and compassionate, others suffer from chronic understaffing, lack of training, or poor management. When a facility does not have enough trained caregivers, residents may not receive the attention they need. Basic tasks like bathing, dressing, feeding, or giving medication on time may be overlooked. Neglect is not always intentional. In many cases, overworked staff are forced to manage too many residents at once. As a result, important signs of health decline can be missed. A resident may develop a high fever, suffer from dehydration, or experience sudden confusion, and no one notices until the situation becomes dangerous. Small health issues can quickly grow into serious problems when not treated early. In some nursing homes, hygiene standards also fall short. Residents may lie in soiled clothes or bedding for hours. Rooms might not be cleaned regularly, and food preparation areas may lack basic sanitation. Poor hygiene can lead to infections, skin conditions, and a loss of dignity. Neglect also extends to emotional needs. Seniors in nursing homes often feel lonely and anxious. If caregivers don't take time to talk, listen, or show empathy, residents can begin to feel invisible and forgotten. Emotional neglect can lead to depression, which can further weaken physical health and motivation to stay active or eat well. Another concern is medication errors. Nursing home residents typically take multiple medications for various health conditions. If staff are rushed, undertrained, or disorganized, mistakes can happen. A resident might get the wrong medication, miss a dose, or receive it at the wrong time. These errors can have dangerous or even life-threatening consequences. Even facilities that seem clean and organized can fall into patterns of neglect if oversight is lacking. Families may not always be able to detect these issues until significant damage has occurred. Loved ones might notice weight loss, sudden behavioral changes, or new illnesses and only then realize something is wrong. In short, neglect in nursing homes is a complex issue. It's not always about cruelty, but often about systems that fail both caregivers and residents. Understanding this risk helps families make better choices, ask the right questions, and stay involved in their loved one's care. Number 2. High risk of infections and illness spread. Another major concern in nursing homes is the high risk of infections. These facilities house many elderly individuals in close quarters, and most residents already have weakened immune systems due to age or chronic health conditions. This creates an environment where diseases can spread quickly and become dangerous, even life-threatening. Common infections in nursing homes include respiratory illnesses like pneumonia, influenza, and COVID-19. Urinary tract infections, skin infections, and gastrointestinal illnesses are also frequent. Because many seniors in these homes have other health issues, such as diabetes, heart disease, or limited mobility, their bodies are less able to fight off infections once exposed. Closed living arrangements make infection control difficult. Shared bathrooms, dining areas, and recreational spaces increase the chances of contact between residents. Even a simple cough or sneeze can release germs into the air or onto surfaces that others might touch shortly afterward. If hygiene standards are not strictly followed, one sick resident can quickly lead to an outbreak. Staff members, visitors, and outside vendors can also carry bacteria or viruses into the facility without realizing it. Even if employees try to follow proper hand-washing and mask-wearing procedures, mistakes happen. And in some nursing homes, staff training on infection control is limited or outdated. Without strong systems in place, illnesses can spread silently until multiple people are affected. Some facilities lack the necessary supplies to prevent and manage infections. They may run short on gloves, masks, disinfectants, or hand sanitizers. Others may not isolate sick residents quickly enough, allowing viruses or bacteria to continue spreading. In some cases, warning signs like fever or fatigue are overlooked, delaying treatment and increasing the risk of complications. Antibiotic resistance is another growing problem in nursing homes. Because infections are so common, antibiotics are often prescribed, but not always appropriately. Overuse or incorrect use of antibiotics can lead to the development of drug-resistant bacteria. These superbugs are extremely difficult to treat and can lead to prolonged illness, suffering, or even death. In addition, residents may not be physically strong enough to withstand prolonged illness. A simple flu virus could lead to pneumonia. An untreated urinary infection might trigger sepsis. Many infections that would be minor in a healthy adult can turn serious or deadly in a frail elderly person. Families often trust that their loved ones will be kept safe from these dangers, but without consistent oversight, good policies, and strong leadership, infection control can break down. It is essential for nursing homes to have strict hygiene protocols, immediate response plans, and well-trained staff to minimize the risks. In summary, the risk of infections in nursing homes is a serious issue. Even with the best intentions, the combination of close living conditions, vulnerable residents, and inconsistent care can turn a single illness into a facility-wide emergency. Families should be aware of these risks and regularly check that infection prevention practices are being followed where their loved ones reside. Number 3. Emotional isolation and mental health decline. One of the most overlooked but deeply harmful risks of nursing home living is emotional isolation. While these facilities provide basic physical care, many elderly residents experience loneliness, sadness, and a gradual decline in mental health. The emotional needs of seniors are just as important as their medical ones, yet they are often not met in institutional care environments. Moving into a nursing home is a major life change. It usually involves leaving a familiar home, parting with personal belongings, and sometimes being separated from pets, friends, or a spouse. For many elderly individuals, this transition creates feelings of loss, disorientation, and grief. These emotions, if not addressed, can lead to long-term emotional distress. Inside the nursing home, social interaction is often limited. Residents may share a room with a stranger, eat meals in silence, or go days without meaningful conversation. Staff members, while often kind, are usually busy and focused on tasks, bathing, feeding, or administering medication, leaving little time for genuine human connection. This lack of social stimulation can lead to feelings of abandonment or being forgotten. Depression is common among nursing home residents. Studies have shown that up to half of long-term care residents show signs of depressive symptoms. Without regular emotional support, the mental health of seniors may worsen over time. A person who once enjoyed reading, walking, or socializing might withdraw, stop participating in activities, or lose interest in eating. This emotional decline can have a direct impact on physical health as well. Isolation also increases the risk of cognitive decline. For elderly people, staying mentally active is crucial for brain health. In a nursing home environment where conversation is limited, activities are repetitive, and stimulation is low, the mind can begin to weaken. Seniors with early memory issues may see a faster progression of dementia when they are not engaged or encouraged to think, learn, or create. Another issue is the loss of autonomy. Many residents feel that they have little control over their daily lives. They eat when they're told, follow a strict schedule, and often can't choose their caregivers or roommates. This lack of independence can erode a person's sense of purpose and identity. Without freedom to make small decisions, a senior may feel powerless, like they are just existing rather than living. Family visits can help, but they are often infrequent, especially if relatives live far away or are busy with work and other obligations. When visits are rare, residents may feel disconnected from the outside world. Even with phones or video calls, the experience is not the same as face-to-face interaction. Over time, this can create a feeling of being emotionally cut off from loved ones. Facilities that prioritize emotional well-being can make a significant difference. Programs that encourage hobbies, offer social groups, or provide access to counselors can help reduce isolation. But not all nursing homes offer these services. In many cases, emotional care is treated as optional rather than essential. In conclusion, emotional isolation is a serious and silent threat in nursing homes. It can slowly damage a resident's mental health, weaken their physical health, and rob them of joy in their later years. Families should ask about emotional support programs, social activities, and mental health resources when choosing a nursing home. Compassionate care must go beyond the body, it must also care for the heart and mind. Number 4. Risk of physical abuse and mistreatment. While most nursing home staff are committed to providing respectful and compassionate care, there are troubling cases where residents suffer from physical abuse or mistreatment. This type of risk, though less common than neglect, is serious and deeply damaging when it occurs. Elderly individuals are among the most vulnerable members of society, and they often cannot defend themselves or speak out when harm occurs. Physical abuse in nursing homes can take many forms. It may include hitting, slapping, pushing, or roughly handling residents during routine care. In some cases, staff may use unnecessary force when helping a resident move, get out of bed, or use the bathroom. These actions may leave bruises, cuts, or even fractures. For frail individuals with thin skin or brittle bones, even mild roughness can cause serious injury. Restraint misuse is another form of physical mistreatment. While restraints are sometimes used for safety, such as preventing a fall, they can be misused or overused. Some residents are restrained for long periods to make them easier to manage, not because it's medically necessary. Being tied down, confined to a wheelchair, or sedated unnecessarily strips a person of dignity and independence and can lead to muscle weakness, pressure sores, and emotional trauma. Sadly, not all abuse comes from staff. Other residents may also be responsible for harmful behavior. In facilities where supervision is lacking, resident-on-resident aggression can go unnoticed. This might include pushing, shouting, stealing, or even more serious forms of violence. If staff do not intervene quickly, vulnerable residents may continue to suffer in silence. Elderly people with dementia or cognitive decline are at even higher risk. They may not remember the abuse, may be unable to describe what happened, or may fear retaliation if they speak up. Abusers often take advantage of this confusion, assuming that the victim will not be believed or that no one will notice. This makes it even more important for families and advocates to watch for warning signs. The warning signs of physical abuse are not always obvious. Unexplained bruises, cuts, or burns should never be ignored. Sudden changes in behavior, such as flinching when touched, withdrawing from others, or showing signs of fear, can also be red flags. A resident who suddenly resists certain caregivers or becomes unusually quiet may be signaling that something is wrong. Unfortunately, some facilities lack strong reporting systems or do not respond seriously when concerns are raised. Fear of legal trouble, damage to reputation, or staff loyalty can lead to cover-ups or inaction. In these environments, abuse can continue unchecked. That's why it's important for families to stay involved, ask questions, and visit often if possible. Open communication with staff, careful observation of physical and emotional changes, and attention to how residents respond to their environment can all help detect problems early. In some cases, installing cameras or using third-party advocates can provide added protection. In summary, physical abuse and mistreatment are rare but real risks in nursing homes. Elderly individuals deserve to be treated with kindness, patience, and respect. Even one act of abuse can have lasting effects on a senior's health and trust. Families must be vigilant, facilities must be accountable, and systems must be in place to prevent harm and protect the dignity of every resident. Number 5. Financial exploitation and lack of transparency. Financial exploitation is a serious and often hidden risk that elderly people face in nursing homes. While most care providers are honest and professional, there have been increasing reports of residents being taken advantage of financially, either through direct theft, manipulation, or unclear billing practices. For seniors who may have cognitive challenges or limited ability to manage their money, the danger is real and lasting. Financial abuse can come in many forms. In some cases, staff members or caregivers may gain inappropriate access to a resident's bank account, credit card, or personal valuables. They might pressure the resident to sign checks, change a will, or make financial gifts. Often, the senior is unaware of the full implications of what they are agreeing to, especially if they suffer from dementia or confusion. Sometimes the abuse is subtle. A caregiver may build trust over time and then slowly begin to ask for small amounts of money or favors. These requests can escalate, especially if the resident feels dependent on the caregiver for help or companionship. Because seniors in nursing homes may feel isolated, they are especially vulnerable to manipulation from those who show them attention or kindness. Another form of financial risk comes from the nursing home itself, specifically from complex or misleading billing systems. Many families are surprised by unexpected charges or unclear fee structures. A resident might be charged extra for basic services such as assistance with eating, medication reminders, or simple hygiene care. In some cases, facilities bundle services together in ways that are difficult to understand or question. For families trying to manage a loved one's care from a distance, it can be hard to monitor what is being billed and why. Monthly statements may be long, technical, or filled with medical codes that make it nearly impossible for a non-expert to verify. Some facilities do not clearly explain when rates go up or why certain charges appear. This lack of transparency can lead to confusion and, in worst cases, overbilling or double charging. Insurance coverage in government programs like Medicaid and Medicare can add more complexity. Families often assume that certain services will be covered, only to find out later that they're responsible for significant out-of-pocket costs. If the nursing home does not help clarify this early on, it can lead to financial stress and conflict. In extreme cases, entire estates have been drained due to long-term stays in nursing homes with unclear financial policies. Seniors who spend a lifetime saving may see their assets vanish in just a few years. Without proper planning and clear communication, families can find themselves unprepared and overwhelmed by mounting expenses. To reduce the risk of financial exploitation, families should remain actively involved in their loved ones' financial affairs. It's important to review bank statements regularly, check billing documents, and question anything that seems unusual. Legal protections like power of attorney and financial guardianship should be considered, especially if the resident has cognitive impairments. When choosing a nursing home, families should ask direct questions about billing policies, additional fees, and what's included in the basic rate. Request written documentation and compare it with what is actually provided. Facilities that are open, clear, and willing to explain their financial processes tend to be more trustworthy. In conclusion, financial exploitation is a growing concern in elder care. Whether through direct theft, manipulation, or lack of transparency, it can cause major harm to both the resident and their family. Protecting a loved one's finances requires vigilance, regular oversight, and open communication, along with choosing a facility that values honesty and accountability. Number 6. Loss of individual dignity and personal freedom. One of the most profound and painful risks for elderly people living in nursing homes is the gradual loss of personal dignity and freedom. While these facilities are designed to provide safety, structure, and support, the strict routines, institutional settings, and lack of personal choice can lead residents to feel like they have lost control over their own lives. This can be deeply distressing, especially for individuals who have spent their lives making independent decisions and managing their own routines. Daily life in many nursing homes follows a rigid schedule. Residents are often told when to wake up, when to eat, when to take medication, and when to go to bed. While this structure can help manage care efficiently, it can also strip away a person's sense of autonomy. A resident may not be allowed to choose what they eat, when they bathe, or how they spend their free time. Over time, this lack of choice can wear down a person's identity and sense of purpose. Personal routines and preferences that once defined an individual's life may be seen as inconveniences in a facility setting. For example, someone who enjoyed staying up late to read may now be expected to turn out the lights at a set hour. A person who was once particular about their grooming, clothing, or meal choices may have few or no options available to them. Being told this is just how it's done here becomes a common refrain that discourages individuality. Residents may also feel embarrassed or humiliated by the loss of privacy. Basic tasks like using the bathroom, changing clothes, or bathing often require assistance, even when the resident would prefer to do these things on their own. If handled without sensitivity, this dependence can cause shame and frustration. When privacy is not respected, such as entering rooms without knocking or rushing someone during personal care, it sends the message that their comfort and dignity are not priorities. The environment itself can feel institutional rather than personal. Shared rooms, identical furniture, and a lack of personal belongings can make it hard for residents to feel at home. While some facilities encourage families to bring familiar items, space is often limited, and residents may have little ability to personalize their surroundings. Without reminders of their past or the things they love, seniors may feel disconnected from their identity. Residents with mobility challenges face additional restrictions. If they are not allowed to move freely around the facility, whether for safety reasons or due to staff limitations, they may feel trapped. Being unable to walk outside, visit another floor, or even leave their room without permission reinforces a sense of helplessness. Over time, this can affect emotional well-being and even physical health as motivation and activity levels decline. Staff attitudes also play a major role in preserving or undermining dignity. When caregivers are respectful, patient, and attentive, residents are more likely to feel seen and valued. But when staff talk over them, ignore their concerns, or treat them as tasks instead of people, it can feel dehumanizing. Language matters too. Using terms like diaper instead of brief or speaking to adults in a childlike tone can come across as disrespectful and patronizing. Preserving dignity in nursing homes is not just a matter of comfort, it is a human right. Seniors deserve to be treated as individuals with history, preferences, and opinions. They should be included in decisions about their care, given options whenever possible, and respected in every interaction. In conclusion, the loss of dignity and personal freedom is a significant emotional risk for elderly people in institutional care. It can affect their sense of identity, mental health, and overall quality of life. Families and care providers must work together to ensure that even within necessary routines, residents retain a sense of choice, respect, and humanity. Aging with dignity should be the goal, not just safety, but true well-being. If you found this information helpful, please subscribe to the channel and give this video a like to support our work.